Today, I'll be asking for your support in dealing with one of the most debilitating diseases within society, cystic fibrosis. Cystic fibrosis, or CF, is a genetic disorder that affects the lungs and also the pancreas, liver, kidneys, and intestine. All babies receive a mandatory screening for cystic fibrosis at birth within Australia, but there are many symptoms that can be attributed to the disease if not diagnosed early. Most symptoms are related to the lungs. Breathlessness, persistent lung infections, and wheezing are the most common signs of the disease. A concurrent mucus-producing cough and inflamed nasal passages are also attributed to cystic fibrosis, while poor growth, weight, and severe constipation are all processes within the body that occur because of the disease. The chromosome in which cystic fibrosis occurs is the 7th chromosome. All people have 2, which are shown in the diagram. It represents over 5% of the total DNA within all cells. The gene involved in cystic fibrosis is found within this 7th chromosome and sends instructions for the cells to create a protein that controls salt movement within the cells. This salt transport gene has been given the name Cystic Fibrosis Transmembrane Regulator, or CFTR for short, by scientists. This CFTR must be found within both of the 7th chromosomes for someone to inherit the disease. Cystic fibrosis is caused by a recessive allele. To contract the disease, a person must have 2 carrier parents. If only one of the person's parents is a carrier, the offspring will become a carrier, as only one of the 2 chromosomes is infected with the salt transport gene. On screen, the Punnett square shows a scenario in which only one parent is the carrier, the father, and therefore 2 offspring are carriers of cystic fibrosis, while 2 have been completely unaffected. However, the family tree shown on screen shows the offspring of 2 carrier parents, resulting in a child who has inherited cystic fibrosis, while the other 3 offspring include 2 carriers and 1 unaffected human. All newborns in Australia are tested for cystic fibrosis to get a head start with early detection and treatment. There is no cure for cystic fibrosis. However, many techniques/medications are used by sufferers in order to limit pain and allow normal living. Medication, such as penicillin or antibiotics, are normally used to treat sufferers. The main focus of these is to loosen mucus for it to be released, lower blood pressure, or improve breathing. Also, for many years, cystic fibrosis has been treated with natural techniques such as mucus release therapy and breathing patterns that help the patient. However, new technology, such as the contraption shown on screen, allows mucus to be thinned along with a vest that massages the lungs to reduce mucus. Although these treatments allow the sufferer relief, they are all short-term fixes for a long-term problem. New technology is revolutionizing the way that sufferers can improve their living conditions and live a healthy life. Lung transplants, removal of nasal polyps, and endoscopy are all available to sufferers as a longer-term fix. CFTR modulator therapies are a new breakthrough, correcting the function of the defective protein for people with specific mutations. However, this is only for a small percentage of sufferers. The need for funding is absolutely crucial. More than 70,000 people live with the disease worldwide, and with no cure, it will continue to affect those living with the disease, as well as the 1,000 new sufferers born every year. With a life expectancy of around 35, 60% less than those living without cystic fibrosis, it is the most devastating disease in the world that can be inherited. It must be cured in the near future, and with more funds, breakthroughs will come quicker, better and easier accessible than if it is overlooked. And with these funds, we can achieve the goal of curing this paralysing disease.